Health tip on hives. Urticaria. Understanding hives. Hives, also known as urticaria, are red, itchy welts that result from a skin reaction. The welts vary in size and appear and fade repeatedly as the reaction runs its course. Hives can be acute, lasting for a few hours to a few weeks. The condition is considered chronic hives if the welts appear for more than 6 weeks and recur frequently over months or years. Chronic hives can be very uncomfortable and interfere with sleep and daily activities. Causes. The welts that come with hives arise when certain cells release histamine and other chemicals into your bloodstream. Doctors often can't identify the reason for chronic hives or why acute hives sometimes turn into a long-term problem. The skin reaction may be triggered by 1. Pain medications. 2. Insects or parasites. 3. Infection. 4. Scratching. 5. Heat or cold. 6. Stress. 7. Sunlight. 8. Exercise. 9. Alcohol or food. 10. Pressure on the skin, as from a tight waistband. In some cases, chronic hives may be related to an underlying illness, such as thyroid disease or, rarely, cancer. Mechanism. The formation of hives involves the release of histamine and other chemicals from mast cells in the skin. These substances cause blood vessels to leak fluid, leading to the characteristic swelling and redness. Symptoms. Signs and symptoms of chronic hives include 1. Batches of red or skin-colored welts, wheals, which can appear anywhere on the body. 2. Welts that vary in size, change shape and appear and fade repeatedly as the reaction runs its course. 3. Itching, which may be severe. 4. Painful swelling, angioedema, of the lips, eyelids and inside the throat. 5. A tendency for signs and symptoms to flare with triggers such as heat, exercise and stress. 6. A tendency for signs and symptoms to persist for more than 6 weeks and to recur frequently and unpredictably, sometimes for months or years. Short-term, acute, hives appear suddenly and clear up within a few weeks. Complications. Chronic hives don't put you at any sudden risk of a serious allergic reaction, anaphylaxis. But if you do experience hives as part of a serious allergic reaction, seek emergency care. Signs and symptoms of anaphylaxis include dizziness, trouble breathing, and swelling of your lips, eyelids and tongue. Seeking prompt medical attention is important if symptoms like difficulty breathing, swelling of the face or throat, or dizziness occur. Diagnosis. Diagnosis of hives is usually based on a physical examination and a detailed medical history. In some cases, additional tests such as blood tests or allergy testing may be recommended to identify triggers. Treatment. The primary goal of treating hives is to relieve symptoms and identify and address the underlying cause. Your doctor will likely recommend you treat your symptoms with home remedies, such as over-the-counter antihistamines. In severe cases, corticosteroids or other medications may be prescribed. If self-care steps don't help, talk with your doctor about finding the prescription medication or combination of drugs that works best for you. Usually, effective treatment can be found. Avoidance of triggers. For individuals with allergic triggers, avoiding the substances that cause hives is crucial. Identifying and managing stressors can also be important for those with stress-induced hives. Preventive measures. Taking steps to prevent hives involves knowing and avoiding triggers, using medications as prescribed, and adopting stress management techniques. Follow-up. For chronic hives, regular follow-up with a healthcare provider is important to monitor symptoms, adjust treatment as needed, and investigate any underlying health issues. Hives can be a transient and uncomfortable skin condition, and while they often resolve on their own or with treatment, recurrent or chronic cases may require further investigation. It's important for individuals experiencing hives to seek medical attention for proper diagnosis and management. Health is life, guide it. Life is wealth, cherish it.